Well, surgery is typically called for when other things aren't working. Surgery is usually when people's activities of daily living are significantly impacted, but also when the pain is simply not tolerable anymore. And again, we like to emphasize that you don't have to wait until you can barely walk. I tell people that you don't wait until you're getting in that wheelchair to wheel yourself around or the power chair to wheel yourself around the grocery store. When you start looking at that chair and wondering, maybe I should be in that chair, you should already be talking to an orthopedic surgeon or someone about saying, hey, maybe there's a better option. Hip replacements have really undergone a little bit of a revolution in the last 5 years and even 10 years. We do minimally invasive and anterior hip replacements. That's really the same thing. Some people have a little confusion there, but we call them direct anterior hip replacements. It's a smaller incision. It's done through the front of the thigh as opposed to the back of the thigh. There's two things about it. Number one, it's less painful and people can rehabilitate much, much faster than they used to. The other thing is it reduces and in many cases almost eliminates the risk of dislocating the hip joint after surgery. The important thing is early motion. It's important to get pain control, not just at the time of surgery, but for the first several weeks after surgery. And it's important to be very aggressive with physical therapy. And I tell people that if you are walking down the hall with a relatively normal gait at about 2 weeks after your surgery, it may still be painful, but you're going to do just fine. Holy Cross Health offers a preoperative teaching class. We encourage everyone to go to the class, whether you're having a hip or a knee replacement. We encourage you to bring your caregiver or someone from your family who's going to go with you through the process. And we encourage you, even if you might have had a procedure before, even if you've had a hip replacement, things change a little bit. The class goes through not just the hospital side and what you're going to have happen during your stay, but the immediate post-op stay. When someone comes home directly from the hospital, we have a physical therapist who's there the day they get home. They start their rehabilitation right away on the day they get home. They rehabilitate just as fast and in some cases faster than they would at a rehabilitation unit.